morning. You're very, very welcome to this session where we will launch and speak about the home care, wound care document that has been presented by EWMA at this conference. We're going to proceed on, and I'm going to introduce our first speaker, who's known to many of you, but who will give you a presentation on the document itself and then go through some of the key aspects. And Dr. Sebastian Probst has been the editor on the document, so I'm going to hand over to Sebastian.
Thank you very much, Georgina. Good morning. Thank you very much for coming. For us, it's a big honor to present to you our document, Home Care, Wound Care. This document is elaborated, produced in collaboration with the ICW, Initiative Chronische Wunde from Germany, and the Tissue Viability Society, and in support with Home Care Europe and EWMA. First of all, I would like to thank my co-authors, Sala Seppinen, Veronika Gerber, Alison Hopkins, Professor Dr. Ritis Rimdaika, and especially Dr. Georgina Gettin. She did a big contribution to this document, and of course, Søren Mortensen from the EWMA Secretariat. I would like also to thank people for their input to this document that are listed below, and to our supporting companies. This document will give you an overview of the main approaches to the organization of wound care within the home care settings across Europe, with case examples from England, Germany, and the Nordic countries. Why did we do this document? We recognized, and I think you see that in your daily practice, that there is a big shift in the location of service delivery from hospital towards home care settings in the management of chronic wounds. The main factors for this shift is the changes in the demographic profile with chronic disease and increased care dependency of our patients, and secondly, the exponential growth of healthcare costs. With this document, we would like to raise the awareness among healthcare professionals, healthcare providers, patients, and informal carers, the industry, and also policymakers of how to manage wounds at home. It consists of this project consists of the document you got at the entrance, and to a national follow-up projects like the one we started in England and the one that we will start in Germany. The document, the arguments of the document is providing best practice care by using modern wound dressings and techniques. I will tell you later something about the minimum recommendations that we are including in this document. I would like to give you a brief overview of this document. The first chapter, the introduction, we talk about the objectives of this document, the definition of home care, wound care. We give also a definition of home care that is provided by Home Care Europe. Then we talk about the document development and acronym and abbreviations. The second chapter, we give an overview of home care, wound care in Europe. There we talk about the wound prevalences and the etiology in home care settings, the home care population, who is our target population there, and the provision of services. There's a home care, wound care overview of EWMA cooperative organizations and regulations of home care within Europe. Chapter 3 will give you models how home care can work. And these models are taken from the NHS England, from Germany, and the Nordic countries. In chapter 5, we give a definition of best practice. This is the umbrella term of this chapter is organization of care. Then we will talk about home care pathways and the chronic care model. We introduced this model because we use this to demonstrate how practice, the flow from the primary to secondary care can be done. Then we talk about the team approach and e-health assisted care. In chapter 5, we talk about challenges and perspectives of home care, wound care. We give an approach how to do a holistic assessment. We talk about nutrition and home care. What are the challenges there about malnutrition? What can we do against that? Then perspectives of patients, informal carers, and healthcare professionals. The last chapter, the conclusions, I will talk in a minute. There, I will demonstrate how it works with the chronic care model. We give some minimum recommendations for healthcare professionals, what kind of education is needed, what kind of skills are needed, and what kind of products can be used within home care, within the home care setting. I will go over to my next presentation and show you what are the minimum recommendations we need for managing wounds and treating wounds in the home care setting. As I mentioned, we did a little survey with our cooperative organizations about how wound care is carried out in their countries. And it's about the same like we found in the literature, and it's very difficult to say how home care is organized within Europe. So it's organized differently, and the thing we have to highlight is it's mandatory that we do an assessment of the patient's needs. And this can only be done by specialized healthcare professionals. Although the tendency is in home care that there will be a shift from registered nurses to non-registered nurses. And that can be a problem, but I would like to show you how we can solve that problem. But first, I would like to introduce quickly the chronic care model from Wagner. This chronic care model will give a way to facilitate partnerships between healthcare systems and communities. There are 6 components that are required in order to affect functional and clinical outcomes associated with the disease management of each patient with a wound, and thus enable an efficient collaboration between primary and secondary care. The first component of the chronic care model is the organization of healthcare. There we recommend that it has to be an effective communication, because this is key to improve service delivery. We recommend that the communication has to be examined, as well as the pathways and the structures there. It has to be enhanced through accurate, timely, and comprehensive documentation, and it has to be avoided that there are repetitions. Like there are different kinds of documentations out, and so that there is no repetition in that, so we can save time. We have to identify the key professionals that are required to deliver wound care in the home care setting. Where are the wound care specialists? Are there wound care nurses? Are there physicians that are specialized in wound care? And once we have identified these, we have to establish links and build a team approach. The second component is the self-management support. And we promote an inclusive and concordant approach to patient care and include the patient and his or her informal carer in the treatment decisions and goal setting. The third component is the decision support. We have to identify the education needs of individuals delivering home care, wound care. That means not only registered nurses, but also non-registered nurses. And they have to acquire specialist knowledge, and so that they can provide assessments when they carry out their care. The fourth component is the delivery system design. We have to adapt clinical practice guidelines to meet the needs of the home care setting. That means not only primary care setting guidelines can be adopted, but also other guidelines that are out there. Then the fifth is the clinical information system. We need baseline data on the prevalence of home care, wound care in an area that can provide vital quantitative data to contribute to future service development and may justify the need for specialist service in this area. Otherwise, till now we have only estimates how many wounds do we find in the community care. Then we have to do ongoing audits of practice development, guideline-driven care and patient outcomes that is essential in order to monitor and evaluate performance and for future planning. The last component, the community resources and policies. We have to define the possibilities of community resources to support home care, wound care services development. And we have to evaluate and document the quality, the cost, and the effectiveness of home care, wound care, and report on a regular basis to policymakers. Only that, so with this way, we can demonstrate how important it is to provide good practice in the home care setting. The next recommendation we make in this document is the minimum recommendations for healthcare professionals, knowledge and skills. The education level. So we have to work with patients and with the complexity of the wound circumstances. We recommend to assess the complex wounds and the wound healing. For most of you, it's clear that we have to do it, but you have to have the skills to provide this, to do this assessment. We have to implement wound management based on best practice and on evidence. That's why it's important that we can collect data or that we can do other studies. We have to select the best available wound care products in the context of the holistic care. Then we have to support patients' independence and participation in decision making. Then we have to educate patients and informal carers in self-care and wound prevention especially informal carers, because they're around of our patients 24/7. Then, one thing I observe still in practice, that there is no documentation. We have to document wound healing, symptoms and treatment of wound, as well as patients and informal carers' concordance with care. Then we have to ensure the continuity of care in all circumstances and in all conditions. We have to integrate multi-professional knowledge for the patient care by using consultation and e-health. But what kind of minimum competences do our healthcare professional need? They have to be able to attend the patient and/or environment of the patient during the different phases in their illness. Then they have to provide education for patients and their informal carers within their social environment. And this can be sometimes very time-consuming. They have to coordinate the management of the wounds regarding the prophylactic and therapeutic principles. And they have to engage in continuous professional development to maintain the knowledge and the skills of these healthcare professionals. Then what kind of products can we recommend to use in the home care setting? We have to encourage the patient and his informal carer to apply the required wound prevention and wound management procedure while using safe products. That means that we don't have that many collateral effects. Otherwise, our patients won't use the modern wound dressings or products. The products have to be simple, easy to use. Probably only one product that fits in several phases of the wound healing process. The use of disposable products, if it's possible. And the use of products that have a wide range of application for difficult wounds, but products that can be used daily, even with simple wounds. The key issues for healthcare professionals when selecting a product in the home care, wound care sector we need wound dressings that can be effectively used through extended parts of the healing continuum. And I think most of the companies provide some of these products. Wound dressings that should not stick to the wound bed and should eliminate or minimize the need for wound bed cleansing. And we need wound products that are easy to use and access, especially if patients or informal carers take part of their loved ones. We need wound products that enable the lowest overall cost, including the cost of the home care service and patient costs. Because we saw in some countries, wound products are not reimbursed by healthcare insurances. And we need products that are eco-friendly. We try to do a little scheme that should help clinical practice how to select and what kind of products we recommend for the home care sector. So we start with product categories, and there we recommend what can be done for wound prevention, the wound bed preparation, the dressings, and the fixation. Then the devices category, what can be done for wound prevention, what kind of garments and wound therapy shoes can be used, and what kind of material has to be provided for patient education and best practice guidelines for health professionals. I hope this scheme can help you to provide best practice in the home care setting. Thank you very much for your attention.